All right. Hey ho, let's go. This is Resistance Radio, where natural selection selects resistance and where public health is supposed to make survival a little less dependent on how lucky, healthy, wealthy, or powerful you happen to be when you got here. So today I want to start a new series here on Resistance Radio, and I'm calling it Soft Eugenics in America. We're going to look at things like Medicaid cuts, vaccine cuts, the dismantling of the CDC and public health infrastructure, the dismantling of food assistance, the dismantling of environmental protections, and also this week, and this is the story I'm going to do, is how health data have now suddenly disappeared. And we're going to ask whether these are just a bunch of unrelated policy decisions or whether they're telling us something about whose lives our government is willing to protect. Because last year, The Guardian published an essay with a hell of a title called MAGA's Era of Soft Eugenics. Let the weak get sick and help the clever breed. And it raised a question that I've not been able to shake. What would eugenics look like if nobody actually called it eugenics? Because America's original eugenics movement wasn't subtle. We divided human beings into being fit or the unfit. We institutionalized people. We forcibly sterilized tens of thousands of Americans. Race, poverty, disability, and immigration status all became excuses for deciding which people society considered valuable. That was eugenics with the label still on the bottle. But soft eugenics would look different. Nobody has to announce that certain people aren't worth saving. You can simply make being saved harder, like take away healthcare, weaken vaccination programs, cut food assistance, dismantle disease surveillance, remove environmental protections, and then tell everybody, good luck, personal responsibility. And here's the problem. Some people have a lot more personal responsibility available to them than others. Money buys doctors. Money buys clean neighborhoods. Money buys time off work. Money buys childcare. Money buys the ability to leave when the water, air, hospital, or school around you becomes unsafe. So I wanted to separate rhetoric from reality. And that's why I've been developing something I call Dr. Derry's public health postulates. It's 4 questions. That's it. Whenever somebody makes a major public health policy decision, ask 1, does this policy increase protection or does it remove it? 2, is the resulting harm foreseeable? 3, who bears the burden of that harm? And 4, does that evidence actually support the reason we're being given for doing it? So let's try Derry's postulates now. Let's take measles. We have a very effective vaccine for the virus. We know how the virus transmits, so we know what happens when vaccination rates fail. Or fall, rather. So if leaders weaken confidence in vaccination or make vaccination harder to get, here's how the postulates would work. Postulate number 1, does this increase protection or remove it? Well, in this case, it removes it, right? So it's a fail. Fewer people are protected means room for more measles to spread. This is not complicated. Postulate 2, is the harm foreseeable? Yes, in this case, when vaccination drops, outbreaks happen. Measles is not known for respecting nuance, so that's also a fail. We knew that would happen. Postulate number 3, who gets hurt? Not everybody equally. Infants too young to be vaccinated, they get hurt. People who are immunocompromised, they get hurt. Kids whose parents get buried in misinformation, they get hurt too. Families and communities where healthcare is already harder to reach, they get hurt. So that's a fail as well. The people with the fewest options carry more of the risk. And finally, postulate number 4, does the evidence support weakening that protection? No, there's no evidence at all. We have decades of evidence that measles vaccination prevents illness, complications, and outbreaks. So that's also a fail. So let's add it all up. Protection is down, harm is predictable, burden is unequal, and evidence against policy direction. So that's 4 questions, 4 failures. And that's the point of the postulates. They strip away the branding because Washington can call something choice, freedom, efficiency, reform, or whatever focus group were tested well that week. The virus doesn't care. So now look at just what happened. We took a preventable disease, we weakened protection against it, we knew what would happen, we knew who was the most vulnerable, and when people got sick, we called it an outbreak. But that's only half the story. The virus caused the infection. Policy helped create the opportunity, and that distinction matters. Because I'm not saying the measles outbreak is eugenics. I'm saying that when government knowingly dismantles protections against predictable harm, and the people most likely to suffer are consistently the people with the least ability to protect themselves, well, that's where soft eugenics questions begins. And that's what we're going to keep asking. Medicaid, protection or exposure, foreseeable harm, who bears it? What does the evidence say when we remove Medicaid from people? What about the CDC cuts? Same four questions. Vaccine dysregulation or disinformation, same four questions. Dismantling of food assistance, same four questions. Environmental dysregulation or deregulation, same four questions. Because Washington has a wonderful vocabulary for making human consequences seem bloodless, right? Again, we talk about efficiency or reform or choice or reducing dependency, cutting waste. Fine, but show me what happens to people. Public health at its best is a promise that we make to one another. Your ability to survive shouldn't depend entirely on whether you were born rich, healthy, connected, or lucky. And when government systemically dismantles that promise, we need language strong enough to describe what we're watching. They don't have to say whose lives matter. Their policies do it for them. So this is Resistance Radio, where natural selection selects resistance. And in soft eugenics in America, we're going to follow these policies all the way to the people who pay for them. So subscribe and please stick with me, because once you know how to ask those four questions, just policy starts looking a whole lot more personal. Thank you so much for tuning in.